If you look at the numbers behind incontinence in women, it's hard to believe just how big an issue it is. Incontinence affects more women than diabetes, breast cancer, and heart disease, but it doesn't get nearly the attention it deserves. That's why the National Association for Continence has created the We Count campaign to help you realize that this isn't just a you problem, it's an us problem. There are treatments available right now that can make a real difference in your life, and we invite you to take action today. Visit nafc.org/we-count for essential facts, insights, and resources on stress and urge incontinence, overactive bladder, menopause-related leakage, and more. That's nafc.org/we-count to learn more and discover that there truly is strength in numbers.
Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org. This podcast is supported by our sponsor partner Medtronic, maker of the InterStim systems for bladder and bowel control. To learn more about InterStim therapy, visit talkleaks.com. Welcome back to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and today we have a really fascinating story. It's a patient story. It's from a woman named Hope, who's going to share with us her journey that she took as she sought treatment for her incontinence issues. So welcome, Hope. Thank you for joining us.
Thank you for having me. I'm so pleased to be here.
And we're pleased to have you. We really appreciate it because incontinence is a subject that a lot of people are reluctant to talk about. And having somebody who can share her story firsthand and really give us the insights that patients go through is incredibly important. So I really do thank you. And I hope that our listeners are going to get an enormous amount out of this. So let's start by tell us a little bit about yourself, your career, and just who you are in general.
So I am 58 years old. As you said, I live in the suburbs of Philadelphia. I had a mother of 3 children, all adults. And I work as a senior caregiver in people's homes, something I started doing about 18 years ago when my youngest went to first grade. And I absolutely love what I do.
Are most of the people you deal with older patients, or are they all different ages, or any particular type of person?
Typically over 75 or so, a lot of just people that can't be in their homes alone and just need assistance and just somebody there to guide them, prompt them to do things, friendly reminders. And I absolutely love what I do.
That's great. I would imagine that you're probably then no stranger to dealing with incontinence from the caregiver side. I'm sure you have some patients who deal with that as well.
Absolutely. You know, they say things get worse as you get older, and it's true.
But I guess that also probably gives you a somewhat different perspective when you started to experience it yourself.
Yes. So I was very young, 35 years old, when this started for me. So it was a whole different perspective because you associate this more with an older person. People assume these are things that just happen as you get older, but it happens to young people as well.
It's true. I've heard that people talk about how sometimes they hear, even from physicians, saying, oh, it's just normal as you get older. But the best analogy I heard when we once had a guest on the podcast who says, yeah, well, heart attacks are normal as you get older too, but that doesn't mean that it's something you should just accept.
So true. It's not, even with age, like these things can be helped and prevented. It's really not acceptable at any age.
Certainly, and especially though at 35, I mean, you talk about, one of the most vibrant periods of your life. So what happened that you started to experience incontinence then?
So in 2001, I gave birth to my 3rd child. And during that delivery, there were things that happened that made it a very stressful birth. And my son was fine, thank goodness. It wasn't until I got home, maybe 2 days after I got home, that I realized I was having a problem. And that problem was not being able to hold anything, bowel or bladder. It was just happening.
That must have been very, very distressing.
It was, I think sometimes after you give birth, you kind of feel like, well, these things can happen. Never did with the other two births. I think in the beginning, I was able to kind of laugh about it. But as it progressed, as time went on and I went back and forth to see my doctor several times, and, there was really no explanation for it. So it wasn't so funny as time went on. I couldn't really laugh it off, although I feel like I do hide things pretty well. So I don't think I was showing my family, my husband, how distressed I was.
We often hear that pregnancy is one of the primary causes of bladder incontinence, in particular for many women. And I guess that you were even beyond that, though, because you said there was also experiencing bowel issues as well.
Yeah, I would say the bulk of my issue was bowel. There was bladder as well, but I think when you have a bowel incontinence problem, you're really not even focused on the bladder anymore at that point. I just was not getting the signal that I had to go to the bathroom. It was just happening
And
regardless of where I was.
really, so you really didn't have any real meaningful control then.
Nothing at all. I had, what they call zero control. And it just was very unpredictable. There was no sign, no warning. It was just happening.
So I can imagine that in addition to just dealing with your symptoms, that would have had to been incredibly difficult just for, going out shopping, going to the movies, having any sort of outside the home life.
It was, I had 3 young children, and, I was fortunate to be a stay-at-home mom at that time, and that was very comforting to be able, like, if I had to get up and get myself ready and go to work outside of the home at that time, I don't think I would have been able to do it. But, I limited my time going out. Sometimes I waited till my husband got home, or he would stop and pick things up on the way home. But there were certain situations I couldn't avoid with my kids that I had to go out. So, and things happened when I went out.
Wow. So what did you do to manage initially?
So, early on in the beginning, I think in my mind, I was very careful with what I was eating because I felt like, well, if I don't eat this, nothing's going to happen. Or I was very regimented with a lot of binding type food products. I really thought everything out, like something so simple as to go to the grocery store. I knew when I got up that day to not eat before we went. So in the early days, that's how I tried to manage everything, mostly with food.
So I guess it was like an all cheese diet all the time.
Thank God I love cheese. So I eat I love cheese. White rice was my very good friend. White potatoes, lots of bread, all just binding things. When you're put in that situation, I think you'll do just about anything to feel better and feel secure that you can go from point A to point B.
Yeah, but that doesn't really sound like a way to live.
No.
So, yeah. So, what did you do then when you realized that, just adjusting your diet is not really doing the trick?
So at that point, after, having some issues the first couple months that my doctor felt might subside after I was healed, I just took it upon myself and I called a specialist local and, went to see him for an appointment. And he sent me to one of the city hospitals for a special testing, and it was an ultrasound that they didn't do at this local hospital, and they determined that my sphincter muscle was not a circle anymore. That explained why I wasn't able to hold anything, because typically the sphincter muscle is a circle and it's working 24/7 to not let anything escape, where mine was not functioning at all.
Well, I want to get to that in a second, but first I want to go back just a little bit to where you first were talking with your physicians? Because you mentioned that you spoke with your doctor. Now, was that first doctor your OBGYN shortly after pregnancy, or was that your general practitioner?
So I pretty much everything was with my OBGYN in the beginning. And at my 6-week checkup postpartum, he couldn't physically see or feel anything that was wrong and just said, you know, it's up to you, but if things don't get better in the next couple months, you should probably see a specialist. So I didn't wait the couple months because it was really getting to me.
That sounds like a good decision.
Yeah, yeah. I tend to be pretty proactive
Hmm.
and I need to know why this is happening. So went to, as I said, a local doctor, and he was very horrified as to what the result of the test was.
I suppose at that point you've been experiencing these symptoms enough that it didn't take an enormous amount of courage to reach out to the specialist either. You were probably ready to talk to anybody who's going to be able to help, or is that a bad assumption on my part?
I can honestly say up until 2001, I've never been a very running to the doctor type person. I just fix things on my own. And if I really need to go, I go. This situation was so hard to live with that not only did I need an answer as to why this is happening, but I needed to know what I can do about it. It was uncomfortable. It was a male doctor, probably 15, 20 years younger than me. Yeah, maybe 10 now that I'm thinking about it. But it was very uncomfortable. But I needed to figure out what was happening. I couldn't manage these 3 kids and all of these. Like I was changing my clothes more than I was changing theirs.
You didn't even have any choices at that point, I would imagine. It's just you've got to get it taken care of.
I did, yeah. So, I went to this doctor to get some resolution and find out what exactly I could do to change the current situation.
So you get your ultrasound, and your ultrasound comes back, and your sphincter muscle is not what it should be. What were the recommendations, or what are the options that you were presented with?
So at that time, I had one option with him to do a sphincteroplasty where they reattach the sphincter muscle into a full circle. It wasn't a lifelong cure or resolution. There was like a 50% chance it would work, but it was something that's really the only thing he could offer me. So I really didn't want to do it. I was nursing my son, and I did the same for number one and number two child, and I wasn't going to do anything different with him. And he said, you're going to have to stop nursing because you're going to have to be in the hospital for 5 days with IV medications. And I slept on it for a couple days and had several bad days and just decided I have to do this. And I found a way with a lactation consultant that I could do everything for my son and have this done as well.
Wow, so that's really fortunate you were able to make it work out. So how did the surgery go for you then?
So the surgery went well, and again, it was stressed to me that this is not a lifetime solution. It's a temporary fix. The recovery was not pleasant. There was no sitting for about 5 weeks. That was a little rough. I was in the hospital for 5 days on IV antibiotics. It wasn't comfortable, but I had hope that that was going to help, and it did. It did. I would say it lasted. I would say I was probably about 40% better. So I was having less accidents, but it was maybe a year that lasted.
Wow, so that sounds like, I mean, maybe a little encouraging, but also, a little disappointing. You go through a pretty significant procedure. You don't
Mhm.
get quite as much relief as you really were hoping for, and it doesn't last very long. What was your mindset like when you started to realize that this was not really going to be a long-term solution?
So I did follow up with the doctor and, they don't do it a second time. This is like a one-time procedure. It's not something that can be redone. So that's where I started with Imodium that became my very best friend over the next 15, 16 years. And that helped to keep me in check. It helped me to be able to go to the store, go to soccer games and football games. And, that was pretty much how I managed everything in addition to the food. And it was kind of like just kind of hoping something else would come along at some point.
And did something else come along at some point?
It did. So in the meantime, I had consulted with a different surgeon in at a city hospital around here, and she was fabulous. She was so informative, gave me so many ideas. Again, that was, it was probably 5 years into this, and the only resolution at that time was a colostomy. She was not willing to do that at that time because of my age and assured me that something else is going to come along. We just have to hang in there. And she was wonderful. I finally, she wasn't someone that I saw on a regular basis, but I did go back to see her around almost 6 years ago. And she introduced me to this idea of the inner stem, but she's not the doctor that performs it, suggested I see one of her colleagues who does this procedure.
So essentially, she said that you could get a colostomy, which for those people who are not entirely sure of what we're talking about, it's where they essentially reroute your intestine through, they make a little like a hole in your abdomen, and then you have to wear a bag that the waste goes into, which I'm sure just from that description, anybody can hear is not something that anybody gets really excited about having done. Although we have had patients on before who said that it was so life-changing for them that they were incredibly happy and grateful for it. So certainly it can be really of benefit. But like I was saying, I don't imagine anybody says, he wakes up in the morning, says, you know what I want to do today.
Right.
So she says, hang on, there may be stuff coming. And then you hear about interstim. Now, for people who are familiar with some of our previous podcasts, they may have heard about interstim, but maybe you want to tell a little bit about what interstim is from your perspective when you first learned about it. How was it positioned to you?
So we were going to table the colostomy for at that point. I agreed to see her colleague who ended up just being unbelievable. He's amazing. I ended up having an appointment with him and he explained how the device works, where it gets implanted, sent me home with brochures, so much information on how the procedure works, and basically just everything I really needed to know, which didn't stop me from researching more. But there is a lead that goes inside of your body, and then there's a battery that also is implanted after a trial period.
Yeah, so it's like a little device. It's like about the size of maybe like a 50-cent piece. Is that about right?
Yeah, that's about right.
Although, when was the last time anybody actually saw a 50-cent piece?
That's true.
But yes, you take so there's this little device, and that gets implanted sort of like right in your back, like right above your buttocks, right? And there's a like a little wire, like you said, a lead that goes to a particular nerve back there. Is that right also?
Correct. So the lead was implanted first, and that is at your sacral nerve. And for the trial period, so it's kind of like a test drive to see how it works with your body. That was taped onto my back. So I had an external battery with an internal lead, and I did what's called a 2-week trial. So I wore it for 2 weeks, and I had results from day one.
Results from day one. That I gotta imagine that must have been like the most unbelievable feeling to all of a sudden see like wow, it just did it.
You know what? I feel like I'm a pretty positive person, but I have to honestly say I went into this procedure with a backup in mind, which was the colostomy, because it's something you just really can't comprehend on how it works until you have it done. I didn't have high hopes. I remember leaving for the hospital that day and I was like, well, hey, we'll just see what happens. And, you know, like the colostomy for me would have been permanent. There would be no reversing. So this idea of the inner stem was like a safe next step. If it failed, then I would have done the colostomy. But I had great results from day one. I actually went to my son's soccer game the same day and stood for 90 minutes at his game, which I couldn't do before.
Wow, that sounds amazing. I can only imagine. Now, for somebody who's wondering, because it does sound a little like magic,
It
they
does.
turn on a switch. But correct me if I'm wrong. Essentially, what happens is that your bladder and your bowels are
Mhm.
controlled through your nervous system, and through there's a brain bladder and a brain bowel connection. And
Correct.
what this device does is that it stimulates. It just sounds just barely perceptible electrical stimulation to this particular nerve that's believed to be
Mhm.
involved with this brain bladder or brain bowel communication. And that stimulation is what has the effect of calming the incontinence. Does that sound right to you?
Yes, and it all made sense because I was getting the urge to have to go. I knew when I had to go, where I didn't experience that the prior 17 years. So it was my life before the interstem. I was racing to the bathroom within like if I was not within like 5 seconds to a bathroom, I was done with the inner stem. It varies. Like there's sometimes where I'm at the grocery store and I feel like I might have to go and I just continue my shopping, come home and then go to the bathroom. It made such an impact on my life. I can't even describe it other than like you said, it was like magic.
Now, I know that it doesn't always work for everybody, of course, because nothing always works for everybody, but I don't think that you're alone in getting good results. I mean, this is, it sounds like it was certainly new information and a new introduction to you, but I also believe that that InterStim has been done for literally hundreds of thousands of people over, something like 20 years. I mean, I may be mistaken about how long, but for a long period of time, this has really been very well tested and proven technologies. So your experience is certainly not unique, that's for sure.
You know what? I think some people they don't achieve immediate results, and that's why there's a length to the trial period. I certainly didn't expect it. I wasn't told that, oh, you're going to go home and have results the first day. I certainly was not told that. It was, some point during the trial period that you will see results. We hope that you'll see results. And I was floored, I mean, I was on top of the world, but I was just, I couldn't believe it. Like the 17 years was kind of, I don't want to say forgotten because a lot of things happened in that time period that you just can't forget. But this just was, it just changed my whole outlook on life completely.
I would imagine that after that soccer game, you probably wanted to call up the doctor and said, "Put this in me now."
Yeah. Oh, I did. I did. And, like I said, I had a 2-week trial, and it's not the most comfortable thing to have something external, a lot of bulk in the back area, like around the hip area. But you know what? It was so worth every second. Like now, when I talk to people about it, a lot of times the people that I speak with will say, what do you mean I can't take a shower during the trial? And I'm like, that's the easy part. It's no big deal.
Mhm.
So at the time when you decide to possibly have it done, the thought of not being able to take a shower is like your biggest crisis. But during the trial and having good results, it's the last thing on your mind.
I could imagine. So you decide that you and your doctor together decide that you are going to have the implant done. How does that procedure go?
There are different trials that they do. So my trial could be different from someone else's. But when I went in for the procedure exactly 2 weeks from the date of the first procedure, they implanted the battery and then connect the lead to the battery. So now the battery is internal. And as you said, like it's kind of like your backside, but your back lower hip area is probably the best way I would describe it. Mine is on my left side. I don't know if they do them on different sides. I would imagine so. Very short, in and out, 30 minutes. And I came home. So it was nice to have the battery internal now at this point versus external.
And so is this forever now?
For me, it is. So at the time, I had what was only in existence was a 5-year battery. They now have longer term batteries. So when my battery is ready for replacement, they will go in and remove the old battery and replace it with a new battery.
Well, that's great. So
Mhm.
you really do have something that's going to be a lasting solution. And do you find that it continues to deliver the same sort of results that you experienced towards the beginning?
It absolutely does. It's still hard to comprehend like how this little lead in this battery is making such a big difference. But I've had times of what I would call urgency where I've noticed that I'm having to get to the bathroom quicker. So this device comes with multiple programs where you can change the program, which will help to give you better results. I've done that on occasion, but for the most part, it functions on its own. I visit the doctor once or twice a year to have the battery life checked. And that's really it. I mean, it just functions on its own. I'm not really doing anything.
That's unbelievable. I bet you wish that you had heard about InterStim a long time before you actually did.
You know, one question that I get asked often is if you could change anything, what would it be? And I always say I would have done this a lot sooner. That's my only regret is not doing it sooner.
And I guess what that also speaks to is that you really do need to speak with a specialist. Go seek out help because if you find people who are aware of the treatment options that are out there, they can offer them.
Exactly. And I have to believe that there are so many more people out there that are having incontinence issues and they maybe have been told that, well, you're getting older, this is going to happen. A lot of times I think for women it's, well, you've had children and you can't don't settle. Don't settle for that. You have to advocate for yourself and be able to go out and talk about it. Like I don't was it a comfortable thing? No, but the specialists that I've gone to are colon rectal. This is what they deal with. So this is not new news for them.
Yeah, I hope that's encouraging because it really should be that, yeah, you're right. It's not comfortable, but it's even less comfortable is dealing with issues like that for the rest of your life.
Oh yeah. I think a big trigger for me was that I was with my youngest son, we were looking at colleges and I always had a backpack in the back seat of my car, always had a change of clothes, wipes, anything and everything I could possibly need. And we arrived for a tour somewhere and I went in the back to get something and he saw the bag and he's like, "Do you need that, mom?" And I said, "I hope not." And we
Yeah.
kind of went on our way and that just kind of stuck with me.
Wow, I could definitely imagine. So, Hope, is there anything in particular that you want listeners to know?
I think what I would suggest would be to, you have to be your own advocate. It's something that's not easy to talk about. You have to seek help for it. It's not acceptable to live like that. And there are viable solutions out there. The InterStim therapy being what I found for resolution and being able to move forward with my life. So I think that's so important to speak up about it and don't be embarrassed. Again, it's not an easy thing to discuss with anyone.
Yeah, one of the things that we say at the National Association for Continence is that there's no shame in being human. And
That's
we try
right.
and stress to people, yeah, you don't, you know what? Everybody has issues. And you know what? Just go to the professionals who deal with it. That's their job and get it done. So, though, this is life without leaks. And even though
Mhm.
we haven't really been talking about bladder leaks today, we have been talking a lot about incontinence related issues. And we always like to end with one little bit of advice, a hint or a tip, or something for people to take away. So I'm wondering if you might have one that you could share as well.
So, seeking this device could be life changing as it was for me. And I feel like, what have you got to lose? That was said to me before I had this done and has always resonated in my mind. And I really had nothing to lose, but everything to gain.
And it sounds like you gained an enormous amount. Thank you for joining us. We really appreciate you sharing your story, and I hope that you are giving a lot of hope to the people out there who are struggling with this issue and who are unsure of what options they have and maybe a little insecure about seeing somebody and talking about it. So thank you. It means an enormous amount.
Thank you. I appreciate you having me, and it was a pleasure.
Life Without Leaks has been brought to you by the National Association for Continence. This podcast was supported by our sponsor partner Medtronic, makers of the InterStim systems for bladder and bowel control. To learn more about InterStim therapy, visit talkleaks.com. Our music is Rainbows by Kevin MacLeod and can be found online at incompetech.com.